Good morning. My name is Mike Del Trecco. I am the interim president and CEO of the Vermont Association of Hospitals and Health Systems that represent Vermont not-for-profit hospitals. Thank you for joining me today to hear about our hospital budgets for the upcoming year. Today I have with me representatives from several hospitals, and I want to thank them for their leadership and for being here today. There's so much to celebrate about Vermont's healthcare delivery system, and I want to start by acknowledging that. We are a tremendous value to our communities. We are places where patients and their families go for care. We are places of hope and healing, and in many ways, we are the economic hub of our communities. Each hospital has gone through an extensive budget review process of evaluating revenues, expenses, and resources that are necessary to care for their patients and communities. Furthermore, each budget has been reviewed and approved by their community board. This is important to note as these boards understand their communities, the hospital-specific challenges, and of course, the importance of affordability. All of this careful work leads to next week, starting on August 15th, when the Green Mountain Care Board will kick off the formal process of reviewing and approving these budgets. As I've said before, these are stabilization budgets and have come at a time of great uncertainty. We respectfully request that these budgets be approved as submitted. I've been working in healthcare for my entire career, and I've never seen a set of circumstances so complex and so severe. This is a perfect storm, and it is not normal. We face workforce challenges like never before. 65% of these budgets go towards covering expenses related to workforce and building operations. Hospitals operate 24/7 and 365 days a year. We cannot close if things are too expensive or for lack of personnel. We are experiencing unprecedented inflation and supply chain issues that are contributing to skyrocketing costs. 30+% of these budgets go towards purchasing medical and surgical supplies and pharmaceuticals to care for patients. Adding to these challenges is the fact that many of our patients are coming in sicker and need more extensive care. To provide some context, over the past 3 weeks, as a system, we have been at between 93 and 96% capacity. And unfortunately, this is becoming a trend, not a one-time occurrence. We have a stressed mental health and long-term care delivery system that places incredible pressure on our hospitals. This drives up costs as patients are stuck in hospitals even when they don't need to be there. Just yesterday, we had 125 patients waiting for placement, and over the last 3 weeks, this number was between 105 and 138. Again, this is not a one-time occurrence. We are still managing a pandemic and preparing for the potential surge in the fall. And we've only just started the conversation around monkeypox. Caregivers at our hospitals are experiencing violence acts against them daily. And under our current regulatory structure, we have not been able to grow at medical inflation. And as a result, today's inflationary pressures are hitting us harder. All of these issues are taking its toll. Our workforce is exhausted, our communities are challenged, and for the current fiscal year, most of our Vermont hospitals are reporting losses. These budgets produce minimal operating margins, an average of 2% for the system. I have to tell you, in my experience, this is razor thin. Margins are critically important as they allow hospitals to maintain and improve their facilities, care for patients, and pay their employees. We need strong hospitals in Vermont. Any margin approved below what has been submitted will jeopardize services and challenge the investments that are necessary to run hospitals and care for the communities. So much of what we talk about in this space are numbers, but for us, this is not a numbers exercise. Behind every figure are people who will be impacted, patients, providers, staff, and our not-for-profit community partners. These are stabilization budgets. They are thoughtful and are needs-based. Again, I respectfully urge the Green Mountain Care board to approve them as submitted. Thank you for listening, and I'll now introduce the speakers for today. Today, the first speaker is Dan Bennett, the CEO of Gifford Medical Center in Randolph, and he will be providing a snapshot of some of the challenges of providing care in rural Vermont. Thanks, Dan.
Thank you, Mike. Good morning, and thank you for joining us today. Gifford has a motto that we follow. It says that we will provide our communities with care that is close to home. These are more than just words. They are an expectation. It is an expectation that was reaffirmed for us this spring during Gifford's community listening tour. During these 5 meetings we held throughout our service area, we sought input on our recently completed community health needs assessment, healthcare services, and any other needs our participants identified. We heard several recurring themes: lack of transportation to get to appointments that are at a distance from home. Many are not able to travel to Burlington or Lebanon for services. The need for greater access to care, ranging from mental health to addiction medicine, medical specialties, and dental care, food insecurity, and medication affordability. The greater message was that our communities look to their local not-for-profit healthcare organizations like Gifford to provide them with this access and support. We are currently facing extraordinary challenges in our healthcare system here in Vermont that threaten our ability to provide access to high-quality care. The budgets we have developed reflect this reality, and they need to be approved in order for us to continue to provide that access. We do not have enough people to fill our positions at Gifford or at other healthcare settings around the state. This has led to unprecedented use of traveling staff at a significant extra cost and to wage inflation, both of which are reflected in every hospital's budget. Workforce challenges across the state and region have created capacity issues at Vermont hospitals. At a time when the need for care at hospitals is high, as you just heard, we have not been able to fully staff all of our regularly available beds and services. And this has already impacted patients. Here at Gifford over the past year, we have had to transfer patients needing life-saving tertiary level care as far away as Albany, New York, and Springfield, Mass. A few weeks ago, we transferred a newborn baby to Albany, New York for neonatal intensive care services. Albany, New York. These long distance transfers were necessary because there were no available beds for these patients in our area. On any given day, between 1/3 and 40% of Gifford's hospitalized patients may be delayed in being transferred or discharged to another appropriate level of care. This can be a transfer to a higher level of care at a tertiary care hospital, or are discharged to a long-term care facility. This is due to lack of available beds at those facilities, who are experiencing the same challenges we are at Gifford. That is neither normal, nor is it acceptable. At Gifford, we collaborate with other hospitals and educational institutions to improve access to care. We work with the UVM Health Network to provide local oncology services. We partner with Dartmouth Health to collaboratively provide high-quality orthopedic services close to home. It is difficult to retain and recruit people to work in the larger population centers in our area. However, it is an even bigger challenge in smaller towns like Randolph, Newport, and Townsend. But we are all taking the necessary steps to train and expand our workforce to meet healthcare needs throughout Vermont. Gifford is investing in our workforce through partnerships with Vermont Technical College, Norwich University, the Randolph Technical Career Center, and Stafford Technical Center to train nurses, nursing assistants, and medication assistants. We maintain an internal training program for certified medical assistants who will work in our practices. These past couple of years have been extremely difficult for healthcare workers. Many have retired early, taken traveling positions across the country, or left healthcare entirely to work in another field. We need to support our healthcare workers, keep them working in Vermont, and ensure they are here to care for our communities. These are not ordinary times. The challenges we are currently facing in healthcare are not normal. The budgets that Vermont hospitals have submitted reflect that reality and is why we need the Green Mountain Care Board's support in approving them. Thank you again for listening. And now I'll turn it back over to Mike to introduce our next panelist.
Dan, thank you for that perspective. It's very important. I'm so thankful to have Lori Profata, the Chief Nursing Officer at Copley Hospital in Morrisville, Vermont, to offer her insight on what it's like for a nurse to deliver care at the bedside. Lori, thanks for being here today.
Great. Good morning. Thank you, Mike. I appreciate it. Good morning, everyone. I'm Lori Profata. I'm the Chief Nursing Officer at Copley Hospital. Thank you. 8 years ago, I went looking for a community and a community hospital I could serve. I wanted to work where I take care of people I live with, my neighbors, my colleagues, my families, their friends. You need to know I'm going to get pretty passionate right here because I have been a nurse for over 35 years. I have experience in academic medical centers, community hospitals, large nonprofit health systems, and critical access hospitals. As a nurse, I have practiced in emergency departments, critical care areas, air medical transport. I've been a board certified nurse practitioner, a nurse educator, faculty, and now a nurse administrator. I know patient care, and right now we have a patient care delivery crisis that is not sustainable. I'd like to make a couple salient points. There is no one on this panel this morning that doesn't believe in safe, affordable, cost-effective, quality care. There isn't anyone in Vermont healthcare that doesn't want to have the right number of staff to safely care for our patients. We all want a reliable, stable workforce that is loyal and fiscally responsible. Our systems are broken. Our staff is exhausted and frustrated. They are working harder, not smarter, and they're working overtime, taking care of sicker patients at a faster pace with higher volumes and more complexity. Mental health, substance misuse, homelessness, access to care, and guardianship issues, to name a few. The use of travelers brings hope to our staff. Travelers are skilled healthcare workers who we need today, not to be just part of our care teams, but to be our teachers and our trainers to help us rebuild our workforce. Yet we are in a constant battle over contracted labor. The use of travelers might not be ideal financially, but it's necessary clinically, not just for nursing, but for all areas. Lab, pharmacy, radiology, physical therapy, our providers. We cannot be penalized for having travelers. They take care of our Vermonters, and they are part of our clinical staff. Every day we watch our patients struggle because they are not in the appropriate care setting we are at capacity everywhere. For example, this year at Copley, we've experienced a 40% increase in our post-acute admissions. These are patients who need long-term care and who are taking up acute care beds as they wait. And they wait. And they wait for choices of care applications to come through. They're waiting for long-term beds to become available in the state. They're waiting for our clinical teams to navigate Medicare Advantage plans. They're waiting for advocates to pursue guardianship. Our emergency department is seeing record volumes, more complex patients, higher intensity of care, and we watch our staff and our patients and our families struggle as we board more and more patients in our emergency department. Our mental health patients sit and wait in an ED bed, on average 39 hours or as high as 326 hours as they wait for placement at an inpatient facility that can care for them. Many of our patients require a sit need for safety. That's not me. Excuse me. A sit need for safety. This means one staff member providing one-on-one observation for one patient. They are often patients with mental health issues and dementia. In the last week alone, we have provided over 148 hours of sitting for safety. I know the Green Mountain Care Board members and staff look closely at numbers and charts as part of their budget approval process. But I want to tell you that there are people behind these numbers. There isn't any chart, number, or widget that tells the right story. Come spend a day with me. Come spend a day with my team. In closing, decisions are being made that will have real consequences. I hope these budgets are approved for our patients because our staff and hospitals need relief. Thank you.
Thanks, Lori. I can't express how much I appreciate you being here today. You personally know there's so much more behind these budgets than the numbers. And you've clearly demonstrated this is about patients, their families, and of equal importance, your staff. And it's clearly you're passionate about why you do the work. So thank you for sharing. Next, I'm pleased to introduce Dr. Kat McGraw, the Chief Medical Officer of Brattleboro Memorial Hospital, who is a great physician leader and a great resource to VAHHS and our team. She'll be offering some insight on delivering care at a community hospital, as well as managing the perfect storm of these challenges. Kat, thank you for being here today.
Thank you for allowing me to speak. As Michael DeTreco said, I come to this moment wearing many hats: physician, hospital leader, and leader in healthcare statewide through the Hospital Association. Leading in healthcare right now is very challenging. We talk about change and transformation, bending the cost curve, and other terms which are all about trying harder. That's really what it boils down to. And our staff are working very hard, and our resources are very thin. All through the pandemic, our staff were dealing with the same issues as everyone else: fear of infection, grocery store shortages, sick family members, canceled vacations, and kids going to school from kitchen tables. But in addition, they were also managing to deliver healthcare in a pandemic, taking care of sick friends and neighbors, sick with a new disease requiring constant vigilance on how to stay safe. Our staff have looked to leadership to keep them safe and provide them with the tools and resources they need to do their jobs. We have had to guide them through changing protocols and countless adjustments with staffing gaps in the midst of such challenges. This has left all of our hospitals with a workforce that is tired, worn out, and truly a bit traumatized. So what does this actually look like? There's a new term being bandied about these days: moral injury, and we find it appropriately used more and more. Moral injury is defined as occurring when someone engages in or fails to prevent or witnesses acts that conflict with their values or beliefs. The current state of hospitals in Vermont is surfacing moments of moral injury. Moral injury is the disconnect we have in being asked to pull together as a team to do the right thing, but not being provided the resources to actually accomplish our work. This is what happens when there are more patients to care for and fewer staff to do the caring. This is what happens when we have more complex care to deliver, donning mask after mask and gown after gown for every patient interaction, and have fewer resources to make that happen. Moral injury is what happens when staff have to care for pediatric patients in mental health crises in our emergency departments, truly one of the worst places for them, for days or sometimes weeks awaiting appropriate placement for care. This is what happens when supply chain issues force doctors to make difficult choices when their trusted medications are not available. Moral injury is sending critically ill patients hundreds of miles away for lack of beds at Dartmouth or UVMMC. Moral injury is also what happens when we try to provide kind, appropriate, trauma-informed care and are met with impossible circumstances of violence. Our entire society is a bit traumatized at the moment, and unfortunately, some of that trauma is being levied on healthcare in ways we could never previously have imagined. When people are seeking medical care, we don't see their best sides. They are stressed and scared. And too frequently now this stress is being directed at us. We see it come across in nasty words directed at nurses and doctors delivering care, and sometimes it comes across as shocking violence. Not long ago, one of my colleague physicians suffered a career-ending injury from a patient. A blow from their patient caused a life-changing physical injury, which has meant they can no longer practice medicine. Tragically, this assault is not in isolation. Both verbal abuse and actual violence is a real issue in Vermont healthcare and is further traumatizing our staff, not to mention requiring the hiring of expensive travelers to cover for them. Nurses have reduced their hours to try to cope with our changed environment, and this means open shifts and everyone being called upon to fill in. The violence has also necessitated costly physical reconstruction in some areas of our hospitals to improve our staff's safety. But nevertheless, we continue to show up and do all of this work every day. Why? Because caring is our superpower and we want to provide you with perfect care every time. We know that good enough isn't good enough for our kids, our neighbors, or for any of us in Vermont, but this is the dilemma we are facing. Our hospitals need to be prepared to manage whatever comes our way: a sore throat, a broken leg, a new cancer diagnosis, a new unknown contagious disease, and the hospital need the resources to continue to do this. Our caring means Vermont communities also depend on hospitals to manage the issues that don't have other solutions. Hospitals are being called upon to address homelessness, food insecurity, the opioid crisis, mental health crisis, dental care, aging, and the difficulties of life in general in a poor rural state. As Lori mentioned, we increasingly see patients who do not need hospital care stuck in the hospital because there are no other places for them. At my hospital, we recently discharged a patient waiting more than 200 days for an accepting facility, and shortly after, another waiting over 100 days. This ultimately unreimbursed stay takes up space and staff attention that is already stretched thin and needs to be available for the sick folks arriving in our EDs. A hospital is not a regular workplace. It is a workplace that needs to have all of our resources available at a moment's notice. We are in action 24/7, all the time. When you are in the hospital awake at 3 a.m., so are we. When you press the call bell for assistance in getting out of bed, you don't want Siri to answer. You need an actual, well-rested, well-trained human being to assist you, and that's what we have a shortage of: workforce. The workforce challenges facing everyone have a special sustained impact in healthcare. Nurses, ecotechs, physicians, and others are highly skilled. They have years of training, and travelers to replace them are very expensive. Some roles don't have travelers. There are no travelers for environmental services, a role truly essential with infectious disease. So these staff work longer hours, covering for each other, trying to figure out the bare bones of getting by. We are stretching our resources, deferring projects, repairing the broken down CT scanner, and sending our critical care nurses on the ambulance for transfers when EMS doesn't have the critical care staff. We are literally doing everything we can do every day just to do our jobs. Hospitals are trying to provide Vermont with excellent care, but we know we are falling short and it pains us. It's not what any of us want or deserve. We need our hospitals to be supported in the same way that our communities expect hospitals to support them, with skill and resources, expertise, heartfelt caring and appreciation, and a budget that supports this. Everyone needs this. In the workplace, we call it a living wage. In hospitals, we call it a sustainable budget. Hospitals need it now more than ever. Trying to provide these services while struggling to keep the lights on is a recipe for failure for us and for our communities. Thank you.
Kat, thank you so much for sharing. That was very deep and thoughtful. Really appreciate it. Now I'd like to turn it over to Al Gobay. He's the Chief Operating Officer at the University of Vermont Health Network. And Al will provide an overview of how these issues are impacting the academic medical center and how interconnected we are as a delivery system. Thank you, Al. I appreciate it.
No, thank you, Mike. I really appreciate it. And I echo your opening comments about the system and what we're facing. But most importantly, when I look at Kat and Lori and Dan, I hear their voices, and their voices are so similar to the voices within our system. Those are the voices that we listen to, our doctors, our nurses, our environmental techs, cafeteria workers, when we build our budgets. They reflect what our community and what our patients need. And I think we just have to take a moment and think about the passion and the compassion that has already been talked about this morning. And every time I hear about a baby, Dan, or about a patient, Kat, or someone you're trying to transfer to us, Lori, and we can't help you, I just want to say I'm sorry. We wish that we had more capacity. We just don't. You know, our budget is needed to allow us to remain both financially stable, but also to address the workforce crisis that has us in this position. It's important for everyone to understand that we are living and working in extraordinary times, and our budgets reflect these times. But we can't lose sight of the voices that we heard today and the very real needs of our patients and our community that our nonprofit hospitals serve. Our budgets reflect the very real cost inflation that we are experiencing to deliver care. Without adequate funding, we will not be able to improve in the areas that have been pointed out this morning that we are not meeting the needs of our communities or our patients. And so in closing, I just want to say thank you to Lori. I want to say thank you to Kat, and I want to say thank you to Dan for your words this morning. And I hope that as Vermonters hear them, they understand your passion and my passion and all of the people, the great teammates we get to work with that come together every day to care for Vermonters and how important it is to all of us. And so, Mike, I'm going to turn it back to you. But again, thank you to everyone.
Thanks, Al, and thanks to the speakers. To say thank you for sharing your insight would be a gross understatement of the passion and the issues that you're dealing with. So, but thank you for sharing. This is an important moment, and as you've heard, every Vermont hospital is committed to forward progress. We do have deep challenges. We continue to demonstrate our commitment by doing what's right for our communities. And what's doing right for our communities is caring for our patients and working hard to support your staff. We participate in things called value-based care. Like, this is about doing things better for our communities. Most recently, we led one of the best pandemic responses in the country. Kat spoke about all of the difficult things that we are doing and that we might be faced with. There's a lot of uncertainty. We need support for these budgets. They need to steady our organizations, and they need to be here to stabilize our future. These are needs-based budgets. They're nothing extra. I'll stop there and I'll open it up to questions to the media. And I appreciate everybody's time, and thank you.
You can feel free to type your questions into the Q&A, or if you'd like to be unmuted so you can speak, I can do that too. I'm going to allow Timothy McQuiston to talk now from Vermont Business Magazine. Go on, Tim.
Thanks, Beth. One of the questions, and we all noticed this before, is this problem with budgets? Frankly, can we blame the Green Mountain Care Board starting this tight budget tightening before the pandemic? This is a pre-pandemic problem that was caused in large part by the Green Mountain Care Board tightening budgets previously.
Hang on a second. Thanks, Tim. I appreciate your question. To place blame is a difficult thing, and that's not what we're here to do. I will say we can't do this alone, and we need the support moving forward in these hospital budgets. I'd like to turn this conversation over to Kat, Dr. McGraw, to talk a little bit about the budgets and the implications of inflation, and then turn it over to Dan and Al to follow up.
Sure, thanks, Mike. I guess I would say that your question is a pointed one, which I think we do need to acknowledge that this has been a difficult process year over year, and we're seeing the impact of that in our ability to recruit and ability to provide the services that we need to have available for our patients. And it is not new, but it is exacerbated by our current situation, making this even more difficult than any budget year previous. I know Al can speak very eloquently about the impact on that for the medical center, and we all, I think, we have expressed how the impact on the medical center really affects the rest of the state as well. Al?
Kat, thanks. What I would say is we've been pretty transparent for several years now that we have not been happy with the way in which the Green Mountain Care Board has reduced our rates. And the way that we express that is that they're not allowing our rates to cover medical inflation. And medical inflation is often higher than what we think of as consumer inflation, to get technical here and kind of wonky for a second, but only if we are allowed to have budgets that cover our expenses, can we invest in our people, invest in our communities, invest in our facilities. And that's why it's so important. But I think there's a pretty long multi-year record of us objecting to the cuts that we've endured.
I'll jump in as well. And Al used the word investments, and I think that's an important word to focus on here. We've all made investments in population health and participating with the all-payer model here in Vermont. And I think one of the challenges that we've all faced is a desire to see big changes very quickly. That is not something that is possible in a transformative type of effort that we're undertaking with that. What we're asking for now is for support with the reality that exists today and is going to exist over the next year, and hopefully not longer than that. But cost pressures are ridiculous, and we need support with that. But we have to get through that so that we can continue to make those long-term investments. so that we can continue to work with our community members, trying to help them stay healthy and avoid very expensive care wherever that is possible. Those are the things that we're now focused on, we have been focused on, and we want to get back to being able to focus on in the future. That is going to help affordability down the road. So that is what we're trying to do right now. We're trying to get to that stable point where we can get back, continue to make those investments, help our communities be more healthy, and be able to positively impact affordability.
Thanks, Dan.
So Mike, we have a couple of more questions in the Q&A. Jennifer wants to know what changes or increases are in these budgets. Rough numbers, if you have them.
Jennifer, could you clarify your question? There are many changes in these budgets, and they're all directed at delivering patient care. And so I would need some clarification on your question.
Would you like to speak to that, Jennifer? I can allow you to talk.
Yeah, can you guys hear me?
Yep.
Yep, I guess a percentage of, a typical rate increase for patients. How is it going to impact them directly? Last time I think it was 12% asked for. So just roughly, I know each hospital is probably very different, but in general, what kind of increase is our patients going to be possibly seeing?
Sure. The charge increases don't equal dollar for dollar to premium inflation. And recently the Green Mountain Care Board approved premium inflation. Our rate increases average about 10%. Again, it's higher than normal, but it's addressing the unusual and critical circumstances we face. I would like to probably have Al talk about this a little bit more from the academic perspective. Al?
Yeah, thanks, Mike. So, we're estimating that our net patient revenue, I say estimating because, the budget's just a plan. And so, over time, we'll see how we do with those estimates, but we're estimating that our budget needs to grow by about 9.5% in revenue. And so, that's what we need to cover the cost inflation we're seeing. So when you hear, inflation rates in the 9% range year over year, we have a couple of years here of that level of inflation that we're trying to just basically cover the expense of. And that's why our revenue needs to go up by that amount. Is that fair, Jennifer? Does that get out your question?
Jennifer's on mute.
She said yes in the chat.
Okay.
Okay, thanks. And Leora has a couple of questions. She says, do you have a plan B if your budgets aren't approved in full? And then follows up with, and if you get the budgets this year, can you guarantee that next year you'd be able to have smaller growth targets?
Thanks, Leora. As I said, our hospitals run 24/7, 365 days a year. They're not like a normal business. To say plan B would be disingenuous. We care for our communities and our patients. And yet, these are needs-based budgets to do that. So that would be first part of my answer. The second part of my answer would be, there's no crystal ball. I don't know the future. I don't know what next year brings. I don't know if capacity will remain the same as it is. But these are challenging times. And I think, Lori, you really talked pretty passionately about this patient care element and the uncertainty piece. So if you could elaborate a little bit, that'd be fantastic.
So I think it's a great question. And think, reflect about it. And I would just say this is something that keeps me up every night, because we don't know what Plan B is going to be moving forward. What we do know is that we provide 24/7 care, and we can't just deliver less care. We know we have to have staff here. We know we need to take care of these patients. And so we got to keep going with Plan A and think about how we continue to navigate the next problem in front of us.
Any other members of the panel want to address that?
I'm happy to say that, we've worked very hard for years at this point to do what's called bending the cost curve, which is really trying to squeeze out any excess that we could find in a way to really rein in costs for Vermonters. We understand the importance of that, and we've been doing that for a very long time, and with some success. And the problem is that we now have increased costs that we can't buffer in by taking care of unnecessary activities and getting rid of them. We've done that. So if we get this budget this year, your question, can you guarantee that the following year there'd be smaller growth targets? I think we have to guarantee that we want to and are committed to pegging our growth targets to what the actual need is in Vermont for care that is necessary for Vermonters. And that's it's too early to be able to say that and guarantee that in the face of not knowing what kind of surge we're going to have of COVID, but also knowing that we need to be prepared to manage anything that comes our way. It's not something that can be codified that far in advance.
Thanks, Kat. Are there any additional questions from the media?
It's like there aren't.
Well, I'd like to thank Dr. McGraw, Al Gobay, Lori Profata, and Dan Bennett for joining me today. This has been really insightful and helpful. And again, thanks for your time, and have a nice day.
Thank you.